Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Here I will presentation the result of our group discussion analysis which consists of Reza Eka Wulansuci NPM 13, Nirmalati Tahkinasi NPM 24. Finding the difficult words. Triglycerides meaning triglycerida, elderly, tua, comorbidities, komorbiditas, understood, mengerti, contagious, menular, mitigating, meringankan, rapidly, rapid, worldwide, di seluruh dunia, mortality, kematian, lack, kekurangan. Unexplored, belum dijelajahi, propofol, obat propofol, overwhelmed, kewalahan, obtaining, memperoleh, resources, sumber, koagulopati, intubation, intubasi, convalescent plasma, plasma pemulihan, compassionate, penyayang, chloroquine, chloroquine. Encounter, pertemuan, illnesses, penyakit, dekades, dekade, widespread, tersebar luas, converting, mengkonversi, blood vessels, pembuluh darah, vomiting, muntah, furthermore, selanjutnya, autoritatif, berwibawa. Observational, pengamatan, tubuh sistem tabung, prognosis, prognosis buruk, elapering, menghilang, resuscitation, resusitasi, screening, penyaringan, imunologi, imunokompromised, kelainan imun, abdominal pain, sakit perut. B. Finding the main ideas. Paragraph 1. The novel coronavirus disease 2019 COVID-19 is a respiratory viral disease that has rapidly spread worldwide. Paragraph 2. Severe acute respiratory syndrome coronavirus 2 is a positive sense RNA virus and is the cause of COVID-19. Paragraph 3. Most authoritative sources believe that COVID-19 began in Wuhan, China. There is ongoing debate and research into its exact origin in Wuhan. Paragraph 4. Risk factor for contracting the disease remain largely unexplored. Younger patients seem to have a better prognosis, with most children relatively unaffected, and older patients have mortality rates as high as 15% in one study. Paragraph 5. For patients who develop self-illness, the need for hospitalization typically peaks around day 2 until 7 of symptoms, approximately day 10 after exposure. Paragraph 6. The first and foremost role of the nurse is to protect themselves from contracting or transmitting COVID-19. Paragraph 7. The primary initial evaluation of patients includes an adequate screening program. What this includes will vary depending on burden of disease in a specific area. Paragraph 8. The most common test for active infection in symptomatic patients is a nasal swab polymerase chain reaction. Paragraph 9. There is no specific treatment for COVID-19. The treatment is largely supportive. Much of the treatment can be done at home. Paragraph 10. Nursing care must include engaging the care team, patient, and patient's family in excellent communication about palliative care option, advanced directive, and end of life deserve of the patient and family. Paragraph 11. It is important to remember that just because this pandemic is threatened in many areas, not all patients presenting with respiratory symptoms will have COVID-19, although many emergency departments have drastically decreased volumes. Patients will continue to have bacterial pneumonia, heart failure, heart attacks, and other viral illnesses. Arranging the main ideas into a paragraph. The novel coronavirus disease 2019 or COVID-19 is a respiratory viral disease that has rapidly spread worldwide. It is associated with an international pandemic, largely because of its rapid spread, its high mortality, and the lack of a cure or vaccine. Given its rapid spread, it is likely that emergency nurse will encounter patients with now of suspected COVID-19. Surface acute respiratory syndrome coronavirus 2 is a positive sense RNA virus and is the cause of COVID-19 coronavirus or common cause of mild respiratory illnesses in children and adults. Several novel strains of mutation of coronavirus in the past decades have arisen, namely severe acute respiratory syndrome or SARS of 2003 and Middle Eastern Respiratory Syndrome of 2020. Most authoritative sources believe that COVID-19 began in Wuhan, China. There is ongoing debate and research into its exact origin in Wuhan. Nonetheless, the first case identified was reported on December 31, 2019. However, contact tracing and viral analysis has shown the potential for case as far back as November 2019. Risk factor for contracting the disease remain legally unexplored. Younger patients seem to have a better prognosis, with most children relatively unaffected, and older patients have mortality rates as high as 15% on one study. Although most children are largely unaffected by primary infection, there have been recent reports of delayed self-immunologic complication in children, termed multisystem inflammatory syndrome in children. For patients who develop severe illness, the need for hospitalization typically peaks around day 2 until 7 of symptoms, approximately day 10 after exposure. After admission, the small percentage of patients who develop critical illness will do so remarkably rapidly. Most commonly, patients go from minimal oxygen support to intubation within 24 hours. The first and foremost role of the nurse is to protect themselves from contracting or transmitting COVID-19. Adequate personal protective equipment or PPE should be provided to all healthcare workers, especially emergency nurse. Even when caring for patients who are critically, it is important to protect oneself and take the time to don the appropriate PPE despite instinct to want to read their eye immediately. The primary initial evaluation of patients includes an adequate screening program. What this includes will vary depending on burden of disease in a specific area. Many triage screening tools for COVID-19 initially started with travel or known contact screening. The most common test for active infection in symptomatic patients is a nasal swab polymerase chain reaction. This is an aerosolizing procedure, which requires appropriate PPA to obtain. Obtain this test appropriately based on the manufacturer's specification can yield improved sensitivity for detecting small amounts of virus. Next will be read by Reza.
There is no specific treatment for COVID-19. The treatment is largely supportive. Much of the treatment can be done at home. This includes intensive spirometry or breathing exercise, rest, and adequate food intake. Quarantining or isolating at home to prevent spread is of the utmost importance. Patients should be strongly encouraged to avoid going out in public. Food and medication should be delivered if possible. Patients should distance themselves as far as possible from others, at least 6 feet, and they should wear a mask at all times when they must be around others. Hand washing should be strongly encouraged. Nursing care must include engaging the care team, patient, and patient family in excellent communication about palliative care options, advanced directive, and end-of-life desire for the patient and family. It's important to remember that just because this pandemic is rampant in many areas, not all patients presenting with respiratory symptoms will have COVID-19. Although many emergency departments have drastically decreased volume, patients will continue to have bacterial pneumonia, heart failure, heart attack, and other viral illness. The care of the patient must not be compressed nor forgotten with the current focus on COVID-19. D. Translating the paragraph. Penyakit virus corona baru 2019 atau COVID-19 adalah penyakit virus pernapasan yang dengan cepat menyebar ke seluruh dunia. Ini dikaitkan dengan pandemi internasional terutama karena penyebarannya yang cepat, mortalitasnya yang tinggi, dan kurangnya obat atau vaksin. Mengingat penyebarannya yang cepat, kemungkinan perawat darurat akan bertemu dengan pasien yang diketahui atau dicurigai COVID-19. Coronavirus 2 atau SARS-CoV-2 sindrom pernapasan akut parah adalah virus RNA sense positif dan penyebab COVID-19. Coronavirus adalah penyebab umum penyakit pernapasan ringan pada anak-anak dan orang dewasa. Beberapa strain baru atau mutasi virus corona dalam beberapa dekade terakhir telah muncul, yaitu sindrom pernapasan akut berat atau SARS tahun 2003 dan sindrom pernapasan Timur Tengah tahun 2012. Sebagian besar sumber otoritatif percaya bahwa COVID-19 dimulai di Wuhan, China. Ada perdebatan dan penelitian yang sedang berlangsung tentang asal-muasalnya di Wuhan. Meskipun demikian, kasus pertama yang teridentifikasi dilaporkan pada 31 Desember 2019. Namun, pelacakan kontak dan analisis virus telah menunjukkan potensi kasus sejak November 2019. Faktor resiko untuk tertular penyakit sebagian besar masih belum dieksplorasi. Pasien yang lebih muda tampaknya memiliki prognosis yang lebih baik, dengan sebagian besar anak relatif tidak terpengaruh. Dan pasien yang lebih tua memiliki angka kematian setinggi 15%. Dalam satu penelitian, meskipun sebagian besar anak-anak sebagian besar tidak terpengaruh oleh infeksi primer, ada laporan terbaru tentang komplikasi imunologi berat yang tertunda pada anak-anak, yang disebut sindrom inflamasi multisistem pada anak-anak atau MISC. Untuk pasien yang mengalami penyakit parah, kebutuhan rawat inap biasanya mencapai puncaknya sekitar hari ke-2-7 gejala. Kira-kira hari ke-10 setelah terpapar, setelah masuk rumah sakit, presentasi kecil pasien yang mengembangkan penyakit kritis akan berkembang dengan cepat. Paling umum, pasien beralih dari dukungan oksigen minimal ke intubasi dalam 24 jam. Peran perawat yang pertama dan terpenting adalah melindungi diri dari tertular atau menularkan COVID-19. Alat pelindung diri atau APD yang memadai harus disediakan untuk semua petugas kesehatan, terutama perawat darurat. Bahkan saat merawat pasien yang sakit kritis, penting untuk melindungi diri dan meluangkan waktu untuk mengenakan APD yang sesuai. Meskipun naluri ingin segera memberikan bantuan, evaluasi awal utama pasien mencakup program screening yang memadai. Apa yang termasuk di dalamnya akan bervariasi tergantung pada beban penyakit di area tertentu. Banyak alat screening triase untuk COVID-19 awalnya dimulai dengan perjalanan atau screening kontak yang diketahui. Tes paling umum untuk infeksi aktif pada pasien bergejala adalah reaksi berantai polimerase usap hidung. Ini adalah prosedur aerosolisasi yang membutuhkan APD yang sesuai untuk mendapatkannya. Memperoleh pengujian ini dengan tepat berdasarkan spesifikasi pabrikan dan meningkatkan sensitivitas untuk mendeteksi sejumlah kecil virus. Tidak ada pengobatan khusus untuk COVID-19. Perawatannya sangat mendukung. Sebagian besar perawatan dapat dilakukan di rumah. Ini termasuk spirometri intensif atau latihan pernapasan, istirahat, dan asupan cairan yang cukup. Karantina atau isolasi di rumah untuk mencegah penyebaran adalah yang paling penting. Pasien harus sangat didorong untuk menghindari keluar rumah di depan umum. Makanan dan obat-obatan harus diberikan, jika memungkinkan. Pasien harus menjaga jarak sejauh mungkin dari orang-orang, setidaknya 6 kaki. Dan mereka harus selalu memakai masker ketika harus berada di sekitar orang lain. Mencuci tangan harus sangat dianjurkan. Asuhan keperawatan harus mencakup melibatkan tim perawatan, pasien, dan keluarga pasien dalam komunikasi yang sangat baik tentang pilihan perawatan paliatif, arahan lanjutan, dan keinginan akhir hidup untuk pasien dan keluarga. Penting untuk diingat bahwa hanya karena pandemi ini merajalela di banyak daerah, tidak semua pasien yang mengalami gejala pernapasan akan mengidap COVID-19. Meskipun banyak unit gawat darurat mengalami penurunan volume secara drastis, pasien akan terus mengalami pneumonia bakterial, gagal jantung, serangan jantung, dan penyakit virus lainnya. Perawatan pasien ini tidak boleh dikompromikan atau dilupakan dengan fokus saat ini pada COVID-19. A. The new information. The novel coronavirus disease 2019 or COVID-19 is a respiratory viral disease that has rapidly spread worldwide. For patients who develop severe illness, the need for hospitalization typically peaks around day 2 until 7 of symptoms, approximately day 10 after exposure. There is no specific treatment for COVID-19. The treatment is largely supportive. Much of the treatment can be done at home. These include intensive spirometry or breathing exercise, rest, and adequate fluid intake. Not all patients presenting with respiratory symptoms will have COVID-19, although many emergency departments have drastically decreased volume. Patients will continue to have bacterial pneumonia, heart failure, heart attack, and other viral illness. F. Conclusion. COVID-19 is an international pandemic with many implications for nursing care in the emergency department. The first priority of any nurse should be to protect themselves with the appropriate PPE. The research on COVID-19 is preliminary and speculative, include most treatment. Healthcare resources may be overwhelmed at times, which may require alteration in previous policies and protocol. Many patients with COVID-19 will be asymptomatic or minimally symptomatic and can isolate and care for themselves at home. The elderly and those with other medical conditions are most at risk for severe illness and respiratory distress. Nursing care should focus on limiting the exposure and spread of the virus. The remainder of care is largely supportive. This may include early pruning, supplemental oxygen, and intubation. Thank you. Too many presentations that we can deliver more or less, we apologize. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.